Long-acting reversible birth control. The implant. A common brand name for the implant is Nexplanon. How it works. The implant is a matchstick-sized rod that is inserted under the skin. It contains the progesterone hormone, which prevents the ovaries from releasing eggs and thickens cervical mucus to prevent sperm from entering the uterus to fertilize the egg. After insertion, the implant is not visible but can be felt. Finally, the implant is approved for 3 years. The implant. Effectiveness. The implant is very effective since with perfect and typical use, fewer than 1 out of every 100 women will unintentionally get pregnant during the first year. How to use. Your provider will numb a small area of your upper arm with a painkiller injection and insert the implant under your skin. If you get the implant during the first 5 days of your period, you will be protected from that moment. If inserted on any other day, you will need a backup birth control for a week. To take the implant out, your provider will numb the area and remove the implant through a tiny cut in your skin. If you wish to continue to use the implant, they can put another one in at that time. The implant. Advantages of using the implant are as follows. The implant provides long-lasting protection without needing to remember to take a pill every day, can make periods lighter, can safely be used by smokers and those with high blood pressure or diabetes, and can be used while breastfeeding. A disadvantage of the implant is that irregular bleeding is fairly common. Other uncommon side effects are weight gain, headache, acne, and depression, which are experienced by 2.3, 1.6, 1.3, and 1% of users, respectively. Finally, the implant does not protect against sexually transmitted infections or HIV. The implant. One myth is that the implant can move to another part of the body. In reality, implants very rarely shift and, if they do, they shift by no more than an inch. Some people believe that there is a lot of pain associated with implant placement. Your doctor will use a medicine to numb the area before insertion to prevent pain. Another myth is that everyone who gets the implant gains weight. In reality, only about 2.3% of patients experience weight gain due to increased appetite. The IUD. There are 2 types of IUDs, those with hormones and those without. Common brand names of hormonal IUDs are Mirena, Kyleena, Luletta, and Skyla. A common brand name for non-hormonal IUDs is Paragard. How it works. Hormonal IUDs are made of plastic and release a small amount of the hormone progestin, which thickens cervical mucus to prevent sperm from reaching the uterus. They also thin out the lining of the uterus and prevent eggs from attaching to the uterus during pregnancy. Hormonal IUDs can last between 3 and 5 years. Non-hormonal IUDs, like Paragard, are made of plastic and copper. They cause inflammation and can make the uterus a hostile environment for sperm, preventing them from fertilizing the egg and surviving in the uterus lining. Paragard is approved for 10 years. The IUD. Effectiveness. With both perfect and typical use, fewer than 1 out of every 100 women unintentionally get pregnant during the first year. How to use. Talk to your gynecologist to decide which type of IUD will suit you best. You can get the IUD inserted at any time of the month. After insertion, a little string will hang down into your vagina. At this point, there is not much you have to do other than check the string ends from time to time to make sure the IUD is in place. If you are not comfortable checking the strings, you can let your provider do that a month after insertion and then yearly. The IUD. The advantages of using IUDs are as follows. IUDs offer long-lasting birth control, can safely be used by smokers and those with high blood pressure or diabetes, can make periods lighter, and can be used while breastfeeding. The IUD. Disadvantages of IUDs are as follows. They can cause spotting between periods. Certain IUDs, such as Paragard, may increase menstrual bleeding. Cramps are common on and off in the first few days after getting an IUD. Sometimes IUDs can slip out, and rarely they can push out through the wall of the uterus or can cause infection. And finally, IUDs will not protect you from sexually transmitted infections. The IUD. A common myth is that IUDs can cause infections and infertility. Many studies have shown that there is no increase in the risk of infections or infertility among IUD users. Another myth is that IUDs are only for women who already have kids. On the contrary, young patients who have never been pregnant are also great candidates for IUDs. Another myth is that your partner will feel the IUD poking him during sex. IUDs are inserted in the uterus and hence cannot be felt during sex. The ends of strings hanging out of the cervix are soft, and only in a minority of cases do they bother the partner.